Hello, everyone, and welcome to the live session. I'm Dr. Sudarshan, and today we are going to talk about a very important topic, which is, I think, very important to be addressed by every person or a chiropractor who gets into neck manipulation. So I see that a lot of people actually check out our videos, and then the first video what we see normally is a neck manipulation, and a lot of people are very scared about this fact, and they feel that oh my god, this is so dangerous, this looks so scary. So this is something that I'm going to talk about, and I'm going to talk about with statistics. It's not just an explanation, or it's not just a story to be shared, but these are some basic facts and statistics which will talk about the importance of neck manipulation and what are the dangers when we compare it with anything like a spine surgery or any other options which would be available in case of a neck pain. But before we start our topic, I would like to let you know about our present status and dates for our future camps. So, Thane and Mumbai, we are available on 24th and 27th of Jan, and we have our upcoming camp next week in Pune. That is from in the next weekend we'll be in Pune, 3rd to 4th of Feb. So I'm putting up the dates basically for anyone who would like to take up appointment can do that. Next week we are in Pune, and yes, we are doing our first camp in Bangalore, uh, which is in the last week of February. So we will be doing our first camp in Bangalore. So all the people who are looking forward to see us in Bangalore will be there in the last week of Feb, and second week of Feb we are in Pune. 27th of Jan I'm available in Thane, and yes, I'm going to take some questions also. So if you have any questions, start typing your questions, and let's come to the topic. So basically, when is it that you think of neck manipulation? We normally think of neck manipulation when um, you undergo neck pain, or you feel a lot of stiffness around the neck, and you feel that instead of popping painkillers, probably doing a neck manipulation followed with exercise will be a better option rather than going for painkillers. But a lot of people do feel that neck manipulation is very dangerous, and you can have some other problems which may be much more than your neck pain itself. So getting a neck manipulation done is not the best of the idea. But let me just issue a statistics which is basically come up from the American Chiropractic Association. And as per the statistics, what are the options available when you have a neck pain besides besides the neck manipulation? What are the options available? The next option would be taking up some sort of NSAID drug, or even opioids, or the worst case scenario, undergoing a neck surgery. That's of course a later story. I mean, when your neck, when you are in a very severe condition, when you have pain on a consistent basis. But when we talk about the dangers, when people compare it with the dangers that we have normally, let me tell you, in spine surgery itself, this statistics is based on American Chiropractic Association. And when we talk about the statistics, I'm comparing this with a 1 million population. 1 million is about 10 lakh people, and this is based for a group of 1 million people. So when you undergo a spine surgery, the dangers or the deaths you can expect in about a million of patients would be 800 per million. That's the kind of death you can expect in case of spine surgeries. Specifically, when you talk about neck surgeries, when I say spine surgeries, there are different level of spine surgeries. There are cervical, there is lumbar, there is thoracic, all different levels of spine surgeries. When you talk about neck surgery specifically, about 530 to 540 people per million, there is a absolute risk of death in case of neck surgeries. So specifically neck surgeries. Okay. Talking about NSAIDs, non-steroidal anti-inflammatory drugs, usage of these drugs on a consistent basis, or wrong sort of prescription that is given, or a consistent intake of these drugs can also lead to risk of death. And that is about we have 153 per million 153 people per million do have this risk of death. Besides this, you also have about 53.6 per million people who consume or under the use of opioids or any other state of drug which can probably help them to relieve pain. So that's the kind of risk when we talk about neck manipulation compared to these options. The options that I've given you are spine surgeries, neck surgery specifically, NSAIDs, and opioids. Followed by this, you have neck manipulation where the chances of death is negligible. Firstly, the risk of death is negligible. The worst case is less than one person per million. The worst case scenario is less than one per person, less than one per million, and that too the risk is stroke. Okay, and that happens only when you have people, you don't have people who have trained for it. Okay, and you just probably undergo doing this casually, or you're going to someone who's not trained for it. So you need to understand what we are doing, or we know what we are doing and what we are trying to achieve by a neck manipulation. So getting scared about that part of it, or I also see a lot of comments in our profile where people mention that, oh my god, this is so scary, and this is, I'm not going to do this and I'm not going to do that. But you should really ask people who have come to us. We have treated more than 10,000 plus patients as of now, and these people who come to us and the kind of relief they see after consuming so much of medicines, undergoing a lot of therapy, a lot of other format of therapies, and when they don't see the relief, and when they see this relief only with a simple manipulation followed by a stretching exercises session also, that's where they feel that, you know, why didn't they do this before? Why could not they do this before? So that's the amount of difference you feel when you actually undergo a neck manipulation. So I hope I have made this very clear when it comes to the risk of death, and for people who are, you know, like completely scared, oh my god, neck manipulation looks very dangerous and I don't think anyone should ever undergo neck manipulation. Now that's just a myth, and there is no fact to it. I have also added all my facts and statistics along with this table. See, a lot of time, a lot of literature, statistics is not available to you, and that's the reason you come up to your own conclusion. That's the reason you feel whatever you see, and you know, you simply feel that, okay, fine, this looks dangerous, so this is dangerous. Many a time you don't see how what exactly happens in a OT, how you are managed in a OT, how you in a operation theater. So talking very loosely about these things is very easy, but you know, you should really all my suggestion is that whenever you undergo a neck manipulation, make sure you go with people who have been doing this on a regular basis, people who are trained on this, because it's not about just that crack, or it is not just about getting that sound from your neck. The idea is that you manipulate your neck in such a way that your range of motion improves, your you know, your overall movement feels better, and you feel a lightheadedness in your neck, and so that's where your manipulation will actually have the best effect. So we have a few people, I have a few questions. Aman Sharma has a question. Do we have a permanent solution for your neck, for our neck and shoulder pain? Permanent solution for your neck and shoulder pain. Okay. Do you have a permanent solution for your appetite? Do you have a permanent solution? Is it possible for you to have all the food that you need in life, just eat it one day, and not eat food for the rest of your life? Is that possible? If that is not possible, then there is no permanent solution for your neck and shoulder pain. You need to understand that your neck and shoulder pain comes because of certain reasons. One of the most important reasons is bad posture. Besides this, it's also your inactivity. When I say inactivity, normally 80 to 90% of people, what we see, have computer related jobs, which means that they have to sit for about 6 hours, 8 hours in a day. Now, human body is not meant to sit. Human body is meant to move. Okay. Sadly, you have the kind of work wherein you have to sit for a longer time, and you know, your neck posture is bad. Definitely, you need to accept that. You need to understand that. And now with that bad posture, You spend your days, you spend your neck in such a bad condition, you have a lot of spasm, and then you complain about neck pain. Then how do you expect a permanent solution? Permanent solution lies if you take care of your posture, if you take care of a proper stretching for your neck, if you do the right sort of therapy at the right time. It's very important that you do this therapy at the right time. A lot of people I have seen are negligent. They have neck pain, but they wait for about 3 months, 6 months, 9 months, 1 year. They sometimes suffer for years, and then they come back to a point where the neck is so bad, and then they kind of want to get rid of it. So that's a pretty late to tell you, and so that's where your permanent solution arises. Okay, there's no permanent solution for anything in life, Aman. You need to understand that nothing in life is permanent. So even if you undergo a surgery, that also doesn't suggest, or that also doesn't confirm that you will never have a neck problem later. You can take up with any surgeon and tell them that you have operated me on a certain level, so is it possible that from here on I will never have a neck problem? That's not the case. No surgeon will be able to assure you on this, because uh, you are, whenever you get yourself operated, you probably get operated for a level or two. Okay, what about the other levels? If your posture is not right, it will obviously start affecting the other levels. So you cannot just completely take this on us, as consultants or as professionals, that is there a permanent solution. Permanent solution lies in you. If you keep your posture right, if you take care of your neck in the right way, if you do the right stretches, if you ensure that you have a strong posture, as well as you are exercising on a regular basis, you yourself can look at it from a permanent perspective. Tina Matharu Bansali is putting up a comment. Please take my call. I'm not sure all the calls that you do through Instagram, or whatever numbers you take up through Instagram, they all are diverted to my team, and of course they will take your calls. At this point of time, it is difficult for me to take the call because I'm already in a session. But yes, I can assure you that my team will get back to you. Yes, I'm coming in Pune, Pranav. I'm in Pune next week. That is from 2nd to 4th of Feb. 2nd, 3rd, and 4th of Feb. We are in Pune, and the last week of Feb we are in Bangalore. We are coming to Bangalore for the first time. Uh, Thank you so much. So I think we have a lot of people joining in for the session, and hope I could throw some light on people who feel that neck manipulation is very dangerous, and you should not attend one, and it looks very scary and things like that. So hope I could throw some light on this and help you with that. And thank you so much, guys, for joining in for this session. Please do put in your comments about this session, and if you have any questions, do put in your comments here, and I will definitely answer your questions in the next session. Thank you so much.